The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, interventional cardiologist Dr. Annie Varghese talks about cardiomyopathy. Gynecologist Dr. Scott Lauer talks about how the InterStim device can successfully treat urinary incontinence in women. Minimally invasive spine surgeon Dr. Douglas Wan talks about an innovative surgical technique he developed called Lumini Microinvasive Surgery. Bariatric surgeon Dr. Scott Stowers with My Bariatric Solutions helps his patient lose weight. Houston Northwest Medical Center features its breast center.
So John is a wonderful man. He is a father, he works every day, but unfortunately he developed coronary disease at an early age, weakening of the heart because of that. So when he presented to me, the heart function was very poor.
I was a jock, watching my diet. I loved exercise. I ran marathons. I was an NCAA certified basketball and football official. And the people that I work with, they knew me and knew that I was a fairly healthy person. So when they found out I had a heart attack, everyone was floored.
Heart failure means the heart becomes weak, whether it's because of blockages or other things. Viral illnesses can cause heart failure. But for him, it was blockage, not getting enough blood, so the muscle became weak over time.
Before I started seeing her, they wanted me to run through a battery of tests. And when she saw the results of those tests, and I believe she was on maternity leave at the time, she came in and wanted to see me. And it was at that point she actually brought up that somewhere down the road I may actually need a heart transplant.
Over the years he's been evaluated by the transplant team, and he didn't need a transplant because we had taken great care of him, and he's very thankful for that, and I'm thankful for medications and therapies that we were able to give him to keep him really controlled on heart failure.
Dr. V is an amazing person. I owe quite a bit to that woman, and I feel very fortunate that she's my cardiologist.
He did have a device, a shock box put in, so that in the event of an arrhythmia, because the vessels are not working and the muscles not working, so electrical abnormalities can occur, and people can have sudden death from heart failure. So we protected him by putting a shock box. And he has been able to work every day, but he takes his medicines and he's doing great. So that's a great testament to having great doctors paired together and great institutions to take care of patients. And we're very blessed here in Texas because of the Texas Heart Institute.
The number one place that germs live on your body is under your fingernails. So try to start digging your nails into a bar of soap when washing in order to reach those germs.
The reason why I got into bariatrics is because of the immediate gratification that it provides. I think this is one of the few procedures where you can literally change and save people's lives. I do all laparoscopic procedures, and that includes the gastric bypass, the gastric sleeve, lap band, and revision surgery, such as the lap band removal to another surgery, such as a gastric bypass or a sleeve. Not all patients who come through for a consultation need bariatric surgery. Some of them will be better served with medical weight loss. That's something that we decide as part of the initial consultation and after the comprehensive testing that I do. We initially start off with testing them for everything. We test for hormone levels, we test their blood work, we test their metabolic rate, we look at their body composition, and that we follow throughout the surgical weight loss process to make sure they're losing the fat mass and not the muscle mass. The actual process does take some work on the patient end. I set them up with a nutritionist who does come here and see them and kind of go over expectations from a nutrition standpoint. I also put them in a very intense exercise therapy program up until their surgery, and then we'll expect them to do that after their surgery. To prepare my patients psychologically, I do have them go see a behavioral therapist because this is a huge change for patients and their families. The amount of weight that they're going to lose is going to be a very large deal for them. They have to change their habits, they have to change their lifestyle, and mentally that can be hard for a lot of patients. I think one of the things that sets a Better Way Center apart is that mine is very comprehensive, but it's very individualized. We spend about 45 minutes initial consultation to decide what's going to be the best route for them and what are they struggling with the most that causes their weight gain. We do comprehensive testing to really individualize programs for patients.
Find your doctor on bestdocsnetwork.com.
I always felt as if I had a bladder infection, and I had been on antibiotics for a long time. You always feel as if you need to go to the restroom, and then when you get there, nothing's happening. There's a lot of abdominal pain. It's hard when you're good for 1 second, and then all of a sudden, you're down for the count.
Jolynn's a very interesting case. She presented with pelvic pain and urinary urgency. She had had several laparoscopic procedures. When she came in, she had multiple urinary tract infections, treated by a family doctor, would never get better.
It was kind of unexplainable. You know, I would do all of the things you would do if you got a bladder infection. You know, I would drink water only and this and that. Sometimes it would just last for the day. Sometimes it'd be a couple days, but it would just come and then it would go. You know, other doctors in the past, they would just give me antibiotics. I didn't have a bladder infection.
True urgency is basically when you get the symptoms, I gotta go, I gotta go, I gotta go. The InterStim works by stimulating the nerves from the sacrum that innervate the bladder, and it can act as a amplifier for the signal, or it can act like a reduction. You know, it's getting overstimulating. She stopped the medication on her own, said, what can we do? I told her we could try a trial of the InterStim procedure.
I wore it for a week and it helped. I fell in love with it, and then I decided that, yeah, this is what I need, and then we went back and put a permanent one in.
With her InterStim procedure, Jolynn basically is treated or in remission. She's actually doing excellent.
I think it's been right about a year since I've had it. I don't know what was happening inside my body, but that InterStim did it. It fixed it. So for me personally, I mean, it's just made me, I don't have to worry about it. You know, it's just, I feel great. I always feel good. I don't ever have that issue.
Find your doctor on bestdocsnetwork.com.
John has a question for Dr. Guy Lewis. Can you do a full smile makeover in a day?
We can do a full smile makeover in a day if you want to do bonding. Bonding is a tooth-colored filling material that we can use to change the color and the shape of your teeth, and they can be done just like veneers, but it's made out of composite, which is a different material. It looks good and it can be very, very nice, but it's not as long-lasting as doing it with porcelain. So if you want to do it with porcelain to get a more long-lasting, a better result, I think in most cases, then you need to do 2 visits. And then you come in the first visit, we get the teeth ready, take impressions, then we have to send it to a lab, and they prepare the porcelain and send it back, and then we put that on at the second visit.
Ask our doctors on bestdocsnetwork.com.
At Lumen Health Spine Care, we developed the latest and the most innovative minimally invasive surgical technique, and it is called Lumini Microinvasive Surgery. This is utilizing the most modern technology so that we can preserve all the normal tissues in your spine without creating any kind of damage to your back and without stripping the muscles. We make extremely small incision and go between the muscle fibers with an endoscope to perform the same procedure as if we performed a traditional open back surgery. The big advantage is that the patients are not going to have significant amount of pain. They're not going to have their muscles stripped off their spine, so therefore it minimizes the bleeding, scarring, pain, so that they could recover so much faster. Patients after undergoing Lumini microinvasive surgery are discharged to home on the same day or the very next day, depending on the type of procedure they're having. And many of the patients can return back to work or their light duty activities pretty immediately after the surgery. So we evaluate the patient to see if they're candidate for Lumini microinvasive surgery by having a full consultation and evaluation, and patient may undergo imaging studies or pain mapping process by our interventional pain specialist so that we can clearly identify and accurately identify their pain generator, and so that we can perform the least invasive procedure for the patient. We developed Lumini microinvasive surgery because I personally witnessed it from my father, who had multiple open back surgery. He went through a significant amount of pain, developed chronic pain, and he had a failed back syndrome and lived 30 years of his life with significant amount of pain. And watching him suffer, I realized that we must do something better than what we're doing now to help all those patients with significant amount of back pain and chronic pain. So we used all the latest technology, worked closely with the engineers to develop the least invasive way to approach the spine.
Ask our doctors on bestdocsnetwork.com.
After a workout, don't eat carbohydrates for at least an hour. Your body will be forced to break down body fat rather than use the food that you have ingested.
At the age of 25, about 15 years ago, I was diagnosed with high blood pressure. And with that high blood pressure came 3 medications. I had a family history of heart disease and had seen a cardiologist since I was 10. Had, just a lot of weight gain with having 2 children. My grandmother had both legs amputated with diabetes. Then my father has diabetes and, just the family history.
Yeah, Lisa is an example of one of our patients that came to see me for the typical problems of inability to lose a significant amount of weight that would affect her health.
Several different doctors for 15, 20 years had been saying that, if you could lose 70 pounds and keep it off, you would get rid of the high blood pressure. There is a huge possibility that you will not be diabetic, that even your heart condition would be just almost completely resolved, and you could even get off of all of the medications. So I chose the gastric sleeve procedure, which for me was just the best choice.
For a sleeve patient, they typically need to be at least 70 pounds overweight. Sleeve is a relatively new procedure that we do where we take out about 80% of the stomach. The whole concept of the surgery is just restrictive in nature, where they essentially are on a low-calorie diet for the rest of their life, but they're not hungry all the time.
I came in, I met with the actual surgeon. I actually sat down with Dr. Stowers and he was amazing. Somebody who just totally makes you feel comfortable. He answered every question. He was very honest with me and reassuring. It was just beyond belief that he was able to make me feel so comfortable. At 1 week post-op, I was literally off of all of my medications. It had already made that big of a difference.
Within a year, she lost about 80 pounds.
I've reached my goal weight. It's been great going from a size 18-20 and an extra large shirt to a size 8-10 and a medium shirt. I never thought I'd see that again, so it's been really exciting.
Here at Houston Northwest Medical Center's Breast Center, we focus on the patient and giving them the best quality care possible. The Breast Center here at Houston Northwest is a comprehensive breast center, meaning that not only can we do screening mammograms, we can also do the diagnostic portion, ultrasounds, MRIs, and biopsies.
I'm currently the medical director at Houston Northwest Medical Center. My primary role is interpreting screening and diagnostic mammograms, breast ultrasound, and breast MRI for detection of breast cancer. Also to determine clinical issues. If a patient comes in with a palpable lump, we want to find out what it is. Doesn't mean it's going to be breast cancer. It may be a simple cyst, it may be a benign tumor, but that is part of the workup that I'm involved in.
All of our nurses are certified nurse navigators here. They help the patient walk through the system, whether it's just for a screening mammogram or all the way through surgery. They help them navigate their care.
At Houston Northwest Medical Center, we have 4 breast patient navigators. We are very fortunate to be able to do what we do. Very few hospitals in the area have the opportunity to have this many nurse navigators, and from the beginning, from screening, from going out into the community, it's all about deliverance of care and continuity of care. So if you just make sure that that care is not broken, then one passes the torch to the next person to make sure from the time that she got her biopsy, from the time that she got her diagnosis, that we actually use the library to give her all the information that she needs to arm herself before she goes to see the surgeon.
At Houston Northwest Medical Center, we're very fortunate that we have a multidisciplinary breast cancer conference every 2 weeks, so twice a month. Every patient that is diagnosed with breast cancer at this hospital will be presented at a conference that is attended by radiologists, pathologists, breast surgeons, oncologists, radiation oncologists, and plastic surgeons, and the nurse navigators.
This is an excellent way for the patient that has been recently diagnosed have a treatment plan mapped out for her by specialists that come to the breast conference.
The Breast Center at Houston Northwest Medical Center is the only certified center of excellence in Houston, Texas. We have a monthly support group called Care, Share, and Be Aware, where newly diagnosed patients can come and share their feelings. They can also bond with other breast cancer survivors to interact with them and learn from them.
We always say no one chose this journey, but if you're walking the journey, you're not going to walk it alone, because we're going to walk it with you.
Coming up on the second half of today's show, vein specialist Dr. Peter Morgan talks about the benefits of using the Clarivane procedure to treat venous insufficiency. Family medicine doctor Richard Honecker addresses common health concerns in our Medical Minute. Cosmetic dentist Dr. Guy Lewis talks about some unique procedures in dentistry he has developed, as well as more doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
Clarivane is a new procedure. It's been out maybe for a year or so. It is a procedure that is associated with less pain, both during the procedure and post-procedure. Patients that have venous insufficiency that don't have it corrected are going to get worse. The question is, how fast will it get worse and how bad will it ultimately get? And that's dependent on the individual, how much of their problem is hereditary or genetic and how much is occupational. The typical presenting signs and symptoms, which include pain, swelling, restless legs, enlarged refluxing vessels. If you have the venous insufficiency corrected, the disease progress will completely stop, and if it recurs, it can be easily treated without significant intervention. When you use a laser or radiofrequency ablation to close veins, it's an energy source that produces heat. And so you're essentially burning the veins using radiofrequency or laser. And in order to control that pain, you have to put a tumescent solution, which is a numbing medicine mixed with normal saline around the vein all the way up the leg. And so that requires several needle sticks, which is uncomfortable, and then that makes the leg kind of full, maybe a little tight. There's some leakage of the fluid. And with the Claravane, that tumescence not needed because Claravane basically has a mechanical agitator, like a skip rope, that spins inside the vein and traumatizes the lining of the vein, and then we inject a sclerosant solution that augments the effect of the skip rope. When you use an energy source, there's always a risk that you could damage a structure that's adjacent to or near to the vein, such as a nerve or maybe even muscle, that sort of thing. And so with Claravane, since there's no laser, there's no radio frequency, you're not using a heat source, and so it's, I think, significantly safer. All of the procedures are very safe statistically. The number of complications is very minimal, but I think there is some benefit with the Claravane with respect to complications.
Request an appointment on bestdocsnetwork.com.
Hepatitis C is a viral infection of the liver, and it can be very bad. You need to be tested for hepatitis C if you fall into certain risk groups. For example, if you're a baby boomer born between the years of 1945 and 1965, you need to have your hepatitis C lab test done because we baby boomers tend to have more of it for some reason. If you've been an IV drug user in the past, if you have tattoos, those are risk factors also because hepatitis C germs can live on needles shared between people or between tattoo artists. If you've had a blood transfusion prior to 1992, that is a risk factor too, because prior to that time we weren't screening blood for hepatitis C. If you've been real promiscuous in your sexual behavior, that too can predispose you to hepatitis C. If you fall into one of those categories, just go to your doctor's office and get a lab test for hepatitis C. It's easy, quick, and then if it's positive, you get it treated. If it's negative, you can be happy that you're negative.
I actually hurt my neck in a car accident when I was in my 20s, and it's progressively gotten worse. My neck would stiffen up, it would hurt a lot, and I'd put heat on it. I loved to read, and I noticed I couldn't read anymore. So I had an MRI and found out that it was critical. That's when I realized I needed surgery, and as a result, found Dr. Bonet.
When Marilyn came, she obviously was in tremendous pain, so in her situation, we had to move quicker so that we can bring her the comfort that she needed.
My neck seemed to lock up, and it would hurt at times, especially if I'd read or I noticed, trying to turn. When I was driving, it was hard to do that, and it would depend on my activities, but it progressively just got worse through the years till, I just could hardly stand it anymore.
Her occurred from a degenerative process. What that is as the joint starting to age and get degenerated, they can do so in such a way that abnormal tissue builds around this joint, bone spurs builds around this joint, and it causes pressure upon the adjacent nerves. She underwent her surgery uneventfully. We were able to clean up all the bone spurs and the disc tissue that was compressing on the nerve. She did have severe compression of the nerve, particularly at one of the levels as it leaves the spine to go down the arm.
He did a 3-level fusion on my neck. And considering that and my age, I feel great. I feel like I could do cartwheels.
She was able to tolerate the intervention uneventfully. By the time she woke up, she was already able to notice the difference between the pain she was experiencing before and after that.
He's a miracle worker. My neck is totally restored. I feel wonderful. The quality of life just seems a lot better because it don't hurt like I did. I can read. I can turn my neck better. I'm a little more comfortable driving. I had to go through the pain after the surgery, which takes a while to heal, but that wasn't that bad or that long. I feel like I've really turned a corner.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
I didn't feel good about myself, and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Taking a multivitamin is a quick and easy way to make sure you're consuming the essential vitamins and minerals you may not be getting from food. Make sure your supplement delivers 400 IU of vitamin D, which is the dose that is said to reduce risk of early death by 7%.
Sarah has a question for Dr. Jerome Nafee. Can compression hose cure or prevent varicose veins?
Compression hose cannot cure or prevent varicose veins or spider veins from forming. They can only improve the symptoms while the hose are in place. The veins need to be treated directly, and the hose cannot cure them. The hose can help temporarily improve the underlying symptoms of heavy, achy, tired legs.
Ask our doctors on bestdocsnetwork.com.
For dry skin, incorporate more avocados into your diet. They're rich in monounsaturated fat and vitamin E, both of which promote healthy skin. Try them on salads and sandwiches, and even in smoothies.
I've been a patient of Dr. Lewis's for several years. My teeth were aging, and also the color was not as good as we'd like it to be.
Over time, as our teeth wear down, our nose and our chin get closer together because our teeth are what hold our nose and our chin apart. And as our teeth grind down, then this dimension of our face starts to collapse. Carol started noticing over time how her teeth looked more and more ground down. So she had worn through the enamel. She had dark spots in her lower teeth. Her upper teeth were real flat and short.
He discussed with me to have the crowns or veneers to give me a little bit of a lift, a smile lift.
We call it a smile lift. It's kind of a play on a facelift because it actually makes your face look younger and longer. And so by going in and opening up their bite and making their teeth a little longer, then it just makes them look so much better.
I thought about it for quite a while because I wasn't really sure if I really wanted to do that. With my husband's prompting, because he had had the procedure and it was wonderful and had a great experience, I decided that I would do it also.
We did all of her teeth. We opened up her bite, which gave me room to make her teeth longer. Now she looks 15 years younger, whiter teeth, which is more youthful. It really made a huge difference on her, and she is so happy. She's such a sweet lady anyway, but now she just kind of radiates this.
I'm very pleased with the way it turned out. Friends and family, they don't say, what did you have done to your teeth? They have a tendency more to say, your teeth look really nice. They can't quite figure out why they look better, which is really what I was hoping for. I just take care of my teeth like I always did, and I'm very, very happy.
Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.